to be recorded. Recording the event allows us to share this valuable content with others who are not able to attend this evening. The opinions shared by the panelists tonight are their own and not the opinions of institutions they represent. We've received so many questions from you in advance of tonight's session, and thank you for that. And we encourage you to post any additional questions you have using the Q&A feature. We'll monitor them and make sure we get as many answered as possible. And finally, if you currently aren't an AMA member, but are interested in making your voice heard through Organized Medicine, we'll post a link to join in the chat, and you can see the join link on your screen here. There's no pressure to join, but the benefits are many. So with that, let me introduce our speakers. We're thrilled to have them tonight. Let me start with Dr. Isaac Kerstein. Dr. Kerstein is Dean of Ohio University Heritage College of Osteopathic Medicine at Cleveland. Next, Dr. Jody Jerome. Dr. Jerome is Senior Associate Dean for Medical Education at Ohio University College of Osteopathic Medicine at Cleveland. And last but not least, Dr. Aaron Allgood. Dr. Allgood is Associate Professor and Chair of the Clinical Science Education Department at ATSU School of Osteopathic Medicine in Arizona. Welcome and thank you all for joining us tonight. So let's get to the meat of the program, the real reason you all are here. I'm going to ask each panelist to give you a brief introduction, share their experience and backgrounds with you. Dr. Kerstein, why don't we start with you?
Well, thank you, Meredith, and thanks to the AMA for hosting this event tonight. The AMA has been a great leader and a friend of the osteopathic medical education profession and the osteopathic profession writ large. I know that on behalf of our college, ATSU Mesa, and Michigan State and others, we've really benefited from all the help that AMA has, and I really appreciate the care that you guys have for our students and hosting this tonight. You know, some quick background then to segue. It was actually at an AMA meeting now almost 5-6 years ago, where we were at the consortium meeting of Accelerating Change in Medical Education, where all the leaders of the 32 schools that were represented in the consortium at that time had the debate with the folks of the USMLE in the room and ACGME and others, and we really had the initial conversation about going pass-fail in that arena. Many conversations followed from that meeting and obviously resulted in a lot of what we're talking about today with USMLE and Complex that have both decided to switch to a pass-fail format for level 1 and step 1.
Wonderful, thank you. Dr. Jerome?
Hi, good evening, I guess, to most of you. I'm Jody Jerome. I think this is a great opportunity for us all to gather and hopefully answer questions, and maybe participation of students in this evening's event will be helpful too, because you may bring up questions that we wouldn't have otherwise thought of as we address our students and our profession to prepare our students the best for a residency match and their careers in the future. So I'm Jody Jerome. I am the Senior Associate Dean of Medical Education at the Heritage College of Osteopathic Medicine. I am an obstetrician gynecologist by training, for those who may be interested, although I've worked in medical education across, since I was a student until now in my career. And I've worked over the years specifically with students preparing for CONLEX about strategies for preparation and how performance impacts placement into residency and experiences as a medical student. And this is an issue I think we're all passionate about. We're all, I think for students, it's important to hear we're all in a similar spot as you right now, trying to determine the path that we're going to head down next, because we have not, this will be our first experience with a pass-fail examination for both USMLE and COMLEX. And we want to make sure our graduates are successful in their career paths, and we'll be learning along with you, but do have some experience with the COMLEX, obviously, in the past that may help guide those, the recommendations we will share with you. So thank you.
Thank you, Dr. Jerome. Dr. Allgood?
Hello. Thank you, Meredith, and thank you for the AMA as well. I'm blessed to be here and be a part of this discussion. I'm Dr. Aaron Allgood. I'm the I'm the clinical chair here at ATSU Selma in Arizona here. And I guess my perspective of the process comes with, I have to do, or I do all the chair letters and the different types of standardized letters throughout the specialty. So, I'm with the students as they go through this process in a lot of ways. And, I'll echo the other panelists, and we're going through this just with you. So we will share everything we know, and as much as we know. But but at the end of it is just trying to make the best guess, a best educated guess on how this environment's going to be with this new change. So we will do our best to give that information over to you in this hour. So thank you.
Fantastic, thank you. Before we get into our Q&A, I'll turn it over to our panelists just to provide any additional background information and to share a little bit more, I guess expand on how we got here. Dr. Allgood, would you like to start?
Sure, and I guess, I'm going to, I was looking at resources to share, things that are pretty easy to look up to see kind of what, as we try to predict how the future is going to be with the recent change. So I'm going to share screen here and show you a survey done by the NRMP. And this is really easy to find, nrmp.org, and you can just Google it, Program Director Survey for 2021. And this is a survey that goes out to program directors across all specialties. So you do have to take it in, a little bit with a grain of salt. Not all program directors are answering these surveys, but these come out every year, or at least as far as I know. The 2021 was a little bit easier to read. This one actually, I'm going to show you some statistics, and then you can actually go into the specialty. But I think this gives you, it might give you a good idea. It definitely gives you a good idea of where we just got from, and maybe a predictor to where we're going. If you look at this survey, and this is 2021's published survey, where the question is asked, in deciding who to interview. This is performance characteristics academically, and as you can see, the USMLE Step 1 score was the highest in that, and then MSP Step 2 scores. And so again, when I look at these statistics, I'm not really going off of one thing. I'm looking at kind of basically trends of what program directors might be looking for, and trying to just, utilize this in predicting what they might look for in the future. So with Step 1 going pass fail, and obviously with Level 1 going pass fail, they're not going to be able to use that as much when deciding who to interview. So what are the next things? And MSPE is up there, the Step 2 score, grades in your required clerkship. And so, take a look at this and see where you're at in these surveys. Again, it's not the be all end all, but I do want to highlight a few things. If you look down here, these are the mean importance. Okay, so if this one is the percentage of considered who to interview, these are the mean importance. And one of the highest ranked things is the failures. Okay, any failed attempt at a USMLE and a failed attempt at COMLEX. So as you're making some of these decisions of whether I should take both, or whether I should go back and take one, Step 1, any of those type of decisions, you really have to ask yourself, am I in jeopardy then of failing it? Because that is a powerful indicator here with program directors on deciding who to interview and how to rank. After this is, there's some personal characteristics here. And one thing I'll say about that, and I mentioned that I do a lot of the letters. So letters of recommendation are important, making sure that you have really good relationships with those that you're rotating with, and the letters. And so that was ranked pretty high. And then again, I'm gonna go down here. And just again say this is, so if up there was who to interview, this is how they rank students when they come out with their rankings. And again, the Step 1 score was high. This looks a lot like who to interview. Okay, but if you take out the step 1 or level 1, then you're left with step 2, MSPE, some of those scores. And I think those are what's going to become a little bit more important, and your clinical performance essentially. Again, who to rank, the top thing of importance here was any failed attempts. Okay, so that that's just really telling me that is pretty important. So anyway, I wanted to share that resource. That was that's just really easy to find. The other thing that I wanted to share is whatever specialty that you're considering, there are certain ways that they want you to apply. So for example, internal medicine has a standardized letter, and now it's called a structured evaluative letter, a CEL. It used to be called a SLO just last year. So, and then before that, it was, I don't know, a traditional letter. I don't know, but these change a lot. Okay. So whatever discipline that you are into, you want to make sure that you look that up and, okay, what do I need? The school should be doing a lot of it too, or at least knowing how to, having processes to do this. But I think every individual student needs to get up to date on these structured letters. We have structured letters for ER, internal medicine, OBGYN, and maybe surgery, that depending. And I believe that will probably happen in all specialties in the future. So I just want you to, I want to highlight, be on top of it. Again, pretty much you can Google structured letter and your discipline, and you're going to find this. This is the internal medicine one. There's one for OBGYN here, and then this is the one that looks for internal medicine. This is what it looks like. So I just wanted to share some of these resources for you, and to give you as many tools as you go into the application process. Meredith, thank you.
Thank you, Dr. Allgood. Dr. Jerome, anything you would like to add?
I mean, if I just pivot, I want to I've reviewing questions. I'm happy to see some coming in the chat, and we're happy to answer anything you have. I do want to make a generalized statement is we're here in an advising fashion as people that work at colleges who work with students and aiming for their success. I'm happy to share any information that I know from the MBOME, but we don't represent the MBOME and their guidelines and their statement, and their practices. So I'm happy to counsel you about how I recommend students use MBOME resources for preparation for examinations, and because there's a lot of really great stuff out there, and that might be something students want to hear about, how do you counsel students to use preparatory materials, et but specifically, we are no more in the know than the general public about the next steps or planning from the MBOME, but I'm happy, but I may know some of the answers because I'm up to date on the literature. And I think that's an important thing. I'm guessing that Dr. Christine and Dr. Allgood probably feel the same way, is we're happy to support your success on the exam, but we may not know the answers to the questions that you have specifically about decisions that the MBOME may make.
Understood. Thank you very much for clarifying
and
that.
I'm happy to pass it off to Dr. Christine to add some pieces. I think he has some historical history about this that I do not, that might be willing to share.
I agree completely. I would recommend, or we can give you the MBOME websites where I was just pulling up the latest data. So, looking at the chat, I see, specific questions about, are they going to reinstate level 2 PE? There's a page on that, and they are still in an indefinite hold. We know, I reviewed that, and I can tell you that as of 4 o'clock Eastern today, that website said as much as I know about the updated thing on that question specifically. I guess I'll come back to the original plan about why we did go pass fail, and the history here, I think you guys are in the middle of it, is that I think nationally we have a big concern that we put our students through a tremendous amount of stress, and we feel like we lose them in the spring of their second year. And we felt, and the national consensus of the medical schools was a way to actually push back a little and to say, should a licensing exam be so really disruptive for medical education? And so the idea was that by going pass fail, it would remove some of that stress. We're in the middle of it now. How's that working for you? There's still a lot of unknowns. Clearly everybody's got to study, and you don't have a really good example yet of what it takes to pass. And once you do, you're like, okay, I studied enough. So that's going to be an important part of it. The other thing is, and this is me speaking, the licensing exams and their folks at USMLE and NBOME might have a different take on this, but the purpose of these exams are licensure exams, and they have been validated for the purposes of licensure. And the most valid numbers that they've always had for the decade prior to this was the pass-fail metric. How high you go up above a failure has never really been validated in either exam to be like, how much more excellent are you if you get a 700 instead of a 500 instead of a, what we do know is that pass-fail cutoff is valid. But let me be really clear. It is valid for the purposes of proving minimal competency and safety for unsupervised practice. Now, I can tell you that no medical school has the mission written on the board saying we're making minimally competent physicians. That is not our role. We are making compassionate, high quality, skilled, talented, wonderful osteopathic physicians in the osteopathic medical schools. But conversely, the program directors, and I know that myself and Dr. Jerome are recovering program directors. I think Dr. Hallgren has some experience in that world as well. There's really not a lot of other good metrics right now. And what you're seeing with these SLOs and cells and some of these standardized forms is a way to start getting at even the ACGME understanding that this step one and level one is not a really good metric to start saying who gets an interview and who doesn't. And so that's just some more background. It is new. You're going to be the first rounds to get through this. But I think that we'll work and learn with you. And that's just more the background I wanted to give, and happy to answer very specifically that I can.
Fantastic. Thank you both for all of this. So let's just get right to it, right? Let's answer the questions and, start with what we came here today to talk about, and make sure that everybody feels that they have their questions answered, at least to the best that we can. One question that came in the chat is, could you also talk about how systems-based practice in osteopathic medicine might be assessed? Whoever would like to take that, feel free.
Well, I could start and then fill in with the other experts. I think one of the things you should look at, especially with is you can go to the USMLE. I'm sorry, let me get all these alphabets right. You can go to the NBOME webpage and actually see what each test shows. And what you'll see actually is that COMLEX 1 and 2 do not cover system-based. In there, they cover public health is one of the topics that's covered in level 1. In level 2, it's all the clinical specialties. When you get to level 3, which is what you take once you're in residency, they then use the core competencies, and systems-based practice is one of the core competencies, as like practice-based learning and improvement, for example. So most of those assessments are actually done in level 3 and step 3 when actually measuring the core competencies when you look at the blueprint for the NBOME.
And I'll follow up with that too, because a lot of I don't know what the assessments are like at other schools, but probably most of us have those core competencies, the AOA's core competencies, which looks a lot like the MD side as well, and systems-based practice is in that core competencies on your rotations. And so that's a category that gets assessed as well. I don't know to what I think there's a lot of improvement to be made there in systems-based practice, but with assessments. But I know that that's probably a category on whatever assessment you have for your rotations as well.
And from a broader scope, if you take a look at the MBOME website at the COMLEX blueprint, there's one for each level of the exam, and it'll give you a breakdown. And this is what we use when we counsel our students for exam preparation. And we actually even suggest using it as a tandem and study for their coursework as well, because of the type of curriculum that we have at our institution. But if you look at the blueprint, it can tell you that the minimum percentage of questions that come from specific areas. And then it actually drills down into level in each of those levels into specific areas. None of this is I mean, it's a blueprint. That's that. It's not quite as detailed as the one that you would use to build your home, but it definitely has a sketch of like where the weight of questions are. So there are, for example, in systems-based practice, it does reference about 2% of the questions will be about that. But the questions are about like working on an interprofessional team. They're questions about things that are relatable to something that's at your skill set and level. So it's not they're not about delivery per se of patient care in a learning environment. Like Dr. Christine said, is much more assessed on level 3, but there may be some questions about how like a team works together on improving patient care and like much more from the public health type of lens and in patient safety, which are things that are likely addressed in your medical education training. And I would suggest like, this is a great way to sort of get a balance. I think often students believe that the things that are assessed on COMLEX are going to be the things that are the hardest for them to learn. And specifically like tends to be like renal physiology or pharmacology of like endocrine drugs, which are all really complicated topics. But in reality, yes, those are tested on the exam, but they don't get more weight than than other areas per se in a similar field. So like having a depth and breadth of knowledge that's broad actually helps you more than having focused areas of like the most difficult things memorized. So I do think that like when you look at the way you prepare for your exam, knowing your relative strengths and weaknesses is important, but you definitely need to emphasize knowing a little bit about everything in order to be successful on this exam.
Wonderful, thank you. Another question that came through the chat is with COMLEX being pass-fail, what other areas will be used to determine who will get a residency spot? I know we touched on this a little bit, but if we wanted to expand on this, I'll let you all take it from here.
Yeah, I'll start here with this, and again, we are predicting. Right, so we're predicting which other areas would fill that gap, I guess. And first off, there hopefully at your school, and there seems to be there are a lot of different ways to assess you, especially in the clinical space, and that's where I think the importance will go more and more is your clinical performance. And so with the MSPE, which takes all the performances together usually, your performances in those core rotations, in the rotations that you're going into specialty, your letters, and then of course the step 2 or level 2, which switches more from basic science over to clinical. So I don't want students to look at that anxiety switching all of it over to one other test. There's much too much anxiety from step 1, level 1 already, and hopefully this pass fail has alleviated some of that anxiety. But our hope is that anxiety, if there is any, gets spread across the different assessments, especially in the clinical space. So take a look, and again, take a look at that program survey and program director survey, and take a look at the different categories, because I think the ones up on top there, and I listed some of them, will probably hold more weight going into the residency application season.
Yeah, the yes and there is the timing of the exam. And so what I caution you too about it is don't be a self-fulfilling prophecy in that the timing of the second exam, whether step, level, both, is going to be in the middle of the most important time for you to get good letters, make really good impressions on rotations, and get really good rotation evaluations. So I think that the self-fulfilling prophecy that I would worry about is somebody cutting out a little earlier, not paying as much attention, or didn't read up the cases that the attending wanted the next day because your head was in the board books. You kind of, what I do think is going to happen is that the program directors are now going to, they'll look at level 2 scores, but I think they will also look a little bit at, especially for the specialty you're going into, they may look at the COMAT, if your school issues COMATs, most do for the specialty you may be going into, or another shelf exam. And those letters are also going to be.
Wonderful. I can transition to the next question. Should osteopathic medical students plan to take USMLE Step 2 in addition to taking COMLEX Level 2 in order to have a numerical score to compare with all students applying for residency?
I'm going to give the most honest answer I can and say it depends. It's really easy to be a purist, especially a purist DO, and feel confident that, and I am confident that students that graduate from DO schools and use COMLEX as their licensure assessment exams are excellent physicians. But I also understand that community is broader than just my idealistic world, and that often students and programs look at USMLE scores in a different way than they may look at COMLEX. I would recommend, and this is with advice we give to our students at our institution, is to discuss specifically with your residency advising staff or physician at your college, the specialty that you're interested in, sometimes the geographic area that you're going, what your whole CV or resume package looks like, and make a decision about taking level Step 2 based on all that information. I can say, I practiced in medicine in Ohio, which had a large number of traditionally osteopathic training programs, and many of our graduates are still successful in matching into competitive specialties with COMLEX scores in traditionally osteopathic communities, whether they're programs or not. I mean, Ohio is a very DO heavy state, to be honest. So the environment is really different. And many of our graduates, it's part of our mission, but many of our graduates stay in Ohio. So I think we actually have more students take USMLE than need to. Probably all schools do, but specific to our institution. But I do understand that students want to be the most competitive they can. So I would really think hard about what you want to do, where you want to go, and then look at the trends of your institution and where the success has lied, because it'll be different based on your geography or your career goals. I would say, for example, if you're going to practice family medicine, internal medicine in Ohio, I see little need to take a USMLE exam to open more doors for you, because there's plenty already, and they're likely competitive programs, and they're likely programs who in Ohio have taken DO graduates with only COMLEX scores for years. That may not be the same in a different environment. I also think it depends on your abilities and skill sets. One of the biggest flaws I saw with COMLEX Level 1 is we would have students elect to take USMLE, but they were not strong test takers, and a score has merit too. I think Dr. Algo shared that data. A passing COMLEX score is not negated, it is not in a failing USMLE score, or the opposite of that, a failing COMLEX score, but a passing USMLE score doesn't put you in a different place. So if you are, one of the unique things of osteopathic medical schools is you have to pass the COMLEX series to graduate. If you are a student who multiple choice test taking is not your superpower, seriously consider making sure that you pass the exam so you can graduate from your institution and move forward. That's and get a degree. So if you're a student that struggles with test taking, focus on COMLEX. And after your attempt at COMLEX in your past, discuss with a residency advising person what they recommend for next steps, or a mentor or somebody who does this at your institution.
I'll add, I couldn't agree more with all of what Dr. Jerome said. And and regionally, it does matter a little bit. You know, I'm over here in Arizona, and we have a lot of California students, and it gets more competitive in those certain areas. So Arizona is a little bit middle of the road, but depending on where in what region of the country, you know, the specialties might be more competitive even within that same specialty. So that's a really good consideration here.
I actually think, and I want to, I saw this float in the chat. There's a question specifically about if we don't know what we want to do, what should we do? This actually sort of opens a door that there's this interesting, so complex exams must be taken in series and you must pass in series. You can take step 2 without taking step 1. So if you don't know what you want to do on day like 2 of 3rd year, it's totally okay. Like, and I'm going to be honest with you, I didn't even know what I want. I was a confident pediatrician when I entered medical school, and that is obviously not where I landed. And that's the beauty of 4-year training. You get a chance to change your mind a few times in the middle. Be grateful I'm not a family doc either. But I am very, I would have been terrible at that. Very great. Like, you have this opportunity that you can think about taking step 2 later, and that you don't have to take step 1 to sit for it. I think that will probably open some doors to our students that they hadn't considered in the past when step 1 scores had the highest value, I guess, in residency programs minds. I mean, I think that was the overarching goal of moving to pass fail is we were like, there's a lot of things we don't know what's going to happen. I was hoping it was going to lower anxiety. I'm not sure yet. I was hoping that numerical values would be weighted as highly in resident selection, because I can confidently say as a resident trainer that the best doctors I know are mediocre test takers oftentimes, because they have other skill sets that are really good at the bedside. And I think that this is great from that perspective, but keeping a step 2 or a level 2 score still puts a number in everybody's brain. And I know we're all numbers chasers. Most of us are type A personalities. We want to be best, and numbers show you that. And pass fail feels really uncomfortable to some of you in that capacity. So there's going to be some growth with that. But I do think it's kind of nice that you don't have to decide yet. You'll have some more time.
Yeah, I couldn't agree more on that. And you know, we'll have some data in a couple of years, but over the last 2 matches, the one data point we get when the school gets our match list from NRMP is we don't know the scores necessarily if the students don't share them with us, but we do know which students shared USMLE scores because the USMLE ID shows up on the list. And this is a non-scientific one school, really one campus that I've really scrutinized. I have yet to see a pattern on students and the USMLEs. I've seen students who've gotten into traditionally MD EM programs without a USMLE, and I've seen students get into traditionally family med DO programs that had a USMLE. You know, there's no correlation. But I do think that there, you know, at some point with NRMP and our bigger the American AAMC or ACOM, AMA might be able to help AOA. We'll get some of that data on that. I will say too that when you look at, this is like the devil's in the details, even on that NRMP data, when you look at the program director survey, remember that when 80% of them say they look at USMLE, it's because 85% of all of the programs were never traditionally osteopathic to begin with. And 10% of the program directors who were answering this question were the ones who have a really big experience with it. So there is a selection bias in this survey. And so I would underline also that a lot of this stuff is, I hate to say it, use this term, things like MSPE and some of these things are negative predictive value. They have negative predictive value. They just want to see, are there any red flags? And the MSPE, for the most part, is just a very objective look. And we all kind of do the same pattern, but they're looking for, you know, more, they know what your scores are. They have an overall idea of what your transcripts say. So beyond letters and things, they're looking at, did you have a disruption in your training? Did it take you longer than 4 years to graduate? If so, why? We have to say if there were any professionalism issues. or any behavioral issues, we have to report that on the MSP. I sign the MSPs for my campus. So they really have a very strong negative predictive value. And so what you want to do is just fly straight, do a great job, work your hardest, and really impress some people. Again, get those letters, get those really good standardized letters. Couldn't say that enough.
I want to just take, there's this one question here that I think is interesting about how, would it be strategic in a strategy to skip step 1 and only take step 2 to get that quantitative score? From a strategy standpoint, I don't know. And again, most of this is we don't know. But what I wanted to say is I don't know what program directors are going to look at in that scenario. If you're a student that didn't take step 1, I don't know if they're going to wonder why, if you have a highly competitive step 2 score, that probably would only bode well. But I just don't know as a strategy, if you're thinking about doing that proactively, meaning, you're going into step 1, level 1 timeframe, I don't, unless you're not feeling confident in that step 1, score. So I guess I just wanted to address that as far as, I've asked program directors about that. What are you going to do with a student that doesn't have even a step 1 score and just has the step 2 score, but both COMLEXs? And, I've gotten some mixed answers on that. So I just wanted to address that comment or that question.
I see
it's a tempting strategy.
This other one. I'm sorry, please go ahead.
No, go ahead, Isaac, I'm sorry.
I was going to go to another question. So if you're expanding on that, please do.
Fine.
No, I just want to say it comes down to how confident you are in that exam, and making sure you're taking exams before that give you an idea on how you're going to do. Because yes, you don't want to do that failure if you can at all avoid that. So, sorry, Dr. Person, go ahead.
No, not at all. I'm looking at some of these questions, and some of them are very specific. What would you do if you were me? Kind of questions. And this is who I am. And these are actually really important conversations. And I'm sorry that we can't do it on a webinar, but you need this with your residency. There's so many residency advising team, or however your college has it set up. There's so many nuances and so many things. And especially if you're looking at a study strategy, I will, only a responsible educator would tell you that it's only somebody who really understands your learning styles, your prior experience, your prior academic performance, and everything else. Could give you that advice. There is no broad brush. This is what you need to do. There are some general data out there, but they're generalizable, right? So students who do more questions and really spend the time and effort really doing the questions, and more importantly, have an active ability to really go understand what you got, to really go back, not just the ones you got wrong, but the ones you got right, especially on the knowledge, and understand why you answered correctly or incorrectly, is one general thing. But I can tell you that there's also some people where if you do too much of that one kind of study, and for some people it may be detrimental, especially because the question had, I have exactly 6 weeks to go, and if I only have 6 weeks, and by the way, 6 weeks is plenty of time, I will say, for all students to prepare for one exam, or even for both. There'll be diminished. I mean, this is a personal thing. It's very anecdotal, but we haven't seen a lot of examples where 10 weeks and 30 weeks has helped more than 6.
Yeah, and I would add, I mean, I saw it's so study strategies differ. I can give you my high 5 points of, maybe not be 5, but high points of study strategies for students. So for students in their first year of medical school, and OMS ones, I recommend getting a copy of the MBOA blueprint, looking where the things in your curriculum align with the blueprint, so that you can when you approach year 2, you can do some complex, or even in year one, do a couple complex questions a week aligned with the topic that you're learning. So if you're doing cardiac physiology, pull out a test bank book and do 5 questions a week in cardiac physiology, because then you're going to see the style of questions on the exam, and you can see where what often happens as a learner is you get the superficial stuff, great. But when you get to the second or third or fourth level questions, as you're reading through the STEM, you're like, you think you're going to know the answer, and then it's answered in the next sentence. And then it's in the third, so you have to take extra steps out. So I think that's great practice, and it's low stakes and low risk to do that, to just do a handful of questions a week to match up with the style of what you're learning. And second year, I would probably increase the number of questions I was doing based on a topic, because from a retention standpoint, you're closer to the exam. At this point of the academic year, where I know all of our students, and likely many of you that are taking the exams in June, I would suspect, are getting more anxious, is what is the right thing for me and my study strategy? And I think there's a couple buckets. So students who are high-performing students who tend to do well in standardized tests tend to do a lot of questions. And the reason they can do that is they're successful in answering the questions that they're testing. So if you're getting 75% of the questions right, you have a high probability of passing complex. And you also have a high probability of doing a lot of questions in a day, 50. Like some people will recommend during dedicated study time to do about 50 questions a day. That's great if you're getting 75% of them correct. If you're getting most of the questions wrong, backing up on the number of questions you're doing and learning the content is probably more of a strategy for you, because you can't learn 50 questions of material you got wrong in one day, but you can, like, at a smaller scale, that's things you can reteach and relearn yourself. These are things you should talk about with this person at your college that focuses on learning learning services and can help you with both test taking strategies, noticing your knowledge gaps, using some of the NBOME tools like ComSay or Wellcom, or test banks that are aligned with COMLEX, or ComBank, for example, are helpful because the questions are the most similar to the COMLEX exam. I often hear from students that they like to use UWorld best for preparation. And while I think it's a fine test bank and it's great for preparation for USMLE, and likely high performing students using that as a test bank will do just fine, it's lacking the osteopathic integration in the test questions that if you do not study, you will not be successful in passing COMLEX. So it is sort of nice to do COMLEX embedded, or if you look at like a ComBank, they definitely infuse more osteopathic thinking and practices into the average question. So it does look different than a USMLE test question. I would look, if you take a ComSay or use Wellcom, at like your overall strengths and opportunities, and make sure you're closing the gap in the things you don't know. You can't just not know an entire area. Like you have to know a little bit about everything. And you also have to know how to answer second and third order questions, or you're going to be so close, but like the question will be about the drug. You'll know the drug, but not the mechanism of action. And like, that's great, but you can't get the question right without the mechanism of action. So make sure you're practicing those style of questions. Dr. Kirstein is totally right. 6 weeks is a lot of time. It's never going to feel like enough time. This is probably one of the first tests you'll take in your life where you just can't know all the answers. And that is totally okay, but it feels uncomfortable. And we know that it's a long test. It stretches your brain in a way that you typically don't use it. And you can't just memorize all the things. But having a strategy that you use, I would also say limit the number of resources you're using to a handful. Well, a lot of students will jump because their friend likes something better and they don't want to miss out. There's too many resources available, to be honest with you. I feel like it's information overload. Find a plan that you like and try not to deviate from it, unless you get advice to do that from like an advisor or somebody who has advised students on COMLEX in the past, who may be able to give you a new approach or realize that the resource you're using is not fitting the gap that you have. But trust yourself to commit to what you have, I guess, is the answer I would say. And trust that one bad day of answering questions doesn't mean tomorrow will be that way. That's the other thing. I would do random questions once you get into your dedicated study time, because if you're doing questions on the topics you review, so if you spend a day reviewing cardiology and then you do cardiology topics, I hope you get the majority of those questions right, but it might not reflect your overall retention ability over time. So usually those are the questions I ask students when they're struggling is like percentage of questions they're getting right in the area they've studied versus an area that like random selection. And I think that's really helpful. And all those new tests, the test banks now are so helpful in providing that analytic data to help you with your success.
I wanted to add that about the first part of that. You know, older students are always going to tell the younger students how lucky you are, or older residents, and like it's just generational. Don't worry about it. Every generation of physicians or future physicians have their own challenges that they need to meet, and you all have the challenge. And Dr. Jerome mentioned it, of maybe informational overload and what to pick. I'm a big fan of that. Just take two resources or one resource and really focus in on that. So I wanted to address this last question here. How far-fetched do you think it would be in the next 5 to 10 years for level 2 to go pass fail? And I don't think that's far-fetched at all. I think what you're going to see more and more in medical education is a competency-based, competency assessment approach, where we might not even have, you know, multiple choice anymore, or you know, letter grades, that type of thing, but hitting milestones and hitting competencies, much like the residencies do and GME does. And I think as we get closer to trying to bridge the gap between medical education, or undergraduate medical education, and graduate medication, we'll probably be doing some of those same things. So that's not far-fetched at all. So I just wanted to add that.
And to that, one of the most exciting things I've seen is how much the medical schools and the ACGME and the residency programs are now planning together and working together. The AMA is leading this with their Change Res Ed and Change Med Ed, and now we're all in the same consortium. But also there's there's the UME, GME, UGRC. We have a lot of them, too many mnemonics, but there are actual groups that are working together to really start answering how can, you know, the programs want to know exactly what you want to know. How can we assess and know who should be competitive in our programs? And I'll segue to the how do you think STEP being pass fail will impact our match when compared to the MD students, since all the MDs are going to be pass fail now? I think we don't know completely, but I can say that since it's the same thing happened to both sides at the same time, I don't think there's going to be a large differential. I think we'll know a little bit more with step 2 and level 2 in this first round to see if some differential really shows up. But in the beginning, I don't think there's going to be a big differential. And I think that you have to look at the overall trend, which is that the percentages of DO grads and LCME grads keep going up, and the percentage of match each year. Ours went up nicely in our profession and in the match as well. So that overall trend, I think, will continue unless something really kind of big changes and we're disrupted a little once the level 2 and step 2 comes around. I don't think the programs in the ACGME really do want to blow it up either. They understand that they want to get and pick the best folks, but they also don't want to just break the system either.
There's a couple of nuts and bolts questions that were sent in advance that I'm happy to address. There was a question about if students would still receive a score, and no, the MBOME is not going to provide a score to students or schools. You will, I believe, still have, the colleges will still have access to the areas where our students performed better, but they're not, it's just a performance report. It's not going to have a number value attached to it. The passing score is still 400. I think that was a question as well. It's a norm test. So like with the MBO, how the MBOME does the back end of that, I don't know, but they're not raising the passing bar. Passing will be the same as passing was for the previous cohort.
Right. It's standardized. And what was this, they're using the same exact system to make a pass that they did to set 400 is the answer. That back end really hasn't changed much. And it's important to know that, you know, the way they do that is actually through they triangulate what the standard should be. They try to figure out what percentage of marginally good students should get this right? What are the percentages that excellent people get this right? They look and study some of the past exams. They use something called the modified Angoff model, which I still don't understand, but they're very smart people who do. But that model hasn't changed, and it's important. I know that I just want to say too that it's not graded on like a Gaussian curve, a normalized distribution. It's not we take the top 80% and they pass. They set a number, a solid number, and if you get those questions right, you will pass. And the back end way that they figure that number out, actually, they have not published any changes to that model on the RBM website. Good question. I'm seeing a few more comments now. We've been talking about this lately. What is the red flag for not passing? And Dr. Jerome and Olga probably know more about this than me, but I really do think that, and I'll use this just as a segue. Well, we really look at ComSays. We're looking at some of the WellCom work, FBFS, COMAT. These are newer ones we don't know how to use, but we have a lot of experience with the ComSay. And Dr. Jerome, I know, has forgotten more about this math than I have ever known.
Yeah, so the NBOME does publish practice tests. I think the important thing it depends on how your college uses these assessments or how you use them individually and how closely you are taking them to your exam date. There are scores, so they are still providing scores to those. So if you were to purchase a ComSay or take a college provided ComSay at your school, you'll get a score back. And I think about it from the framework as a passing score on the exam is 400. There's a margin of error on that. Many institutions set a number closer to, they want to say this is an assurance, right? So a lot of institutions will use a score of 450, which I believe was published by the NBOME at one point as having a really high correlation value. I can say, I've had this conversation with students in the past, and they'll be like, well, my ComSay score in March was 450, but I got a 600. I'm like, well, I hope so. You had that much more time to study. It's a predictor of how you would perform in the exam if you were going to take it now or now-ish. So as you're approaching your studies, if you're using standardized assessments like that, so if you're using a ComSay, if you want to look at the score, you want to see a score increase as you're incrementally preparing for the exam. Having a score of 450 before you sit for the exam is likely, would reassure you the most, but I can say confidently that there are students who don't hit that score or who pass the exam too. We're just trying to just use some of our best data and metrics to help students in preparation. If you're continuing to do questions or use these assessments and your score is stagnant, that's when to reach out for some additional help. I'm always surprised. The biggest growth of a student typically in preparation is literally in like the 2 weeks after they end the semester. Like that's where you're going to see your biggest jump. There's like your focus changes. You're thinking about this assessment. Like I would say 2 to 4 weeks. After that, it's like remembering them, like things like priming your brain on the stuff that's most difficult for you, which typically for students is like physiology and pharmacology. That's across, and pathology, like across the board. Making sure that's in your brain, reviewing OMM topics because they're on the test and they're often things that you have to think a little bit differently about in order to be successful answering the exam. Yeah, and there's a question in the chat, what's the best materials? The ones that work for you. This is an ongoing conversation every year. The student government comes to me and say, why did you get us this resource? We want that one. I was like, well, that's what they wanted last year. So it goes in waves. High performing students tend to use different resources than lower performing students, and that's okay. That doesn't mean low performing students should use the same resources because they're targeted different skill sets. So we use high performing students are going to do really well with these resources that are written at a level that sometimes lower performing students can't grasp the concepts. And so you need to find something that tailors to you. And that's where I would ask for help from someone at your college about what they've had success with, because they work day to day with students. I laugh. I'm like, the problem is we end up a year behind in what students like. I know what they liked last year, but I can't predict what next year will be. So I think that goes to show there's just pretty good resources available. I would get a COMEX style test bank if you were going to ask me for the one thing. And everybody likes First Aid and the green OMM book. That's not green anymore. I don't think.
I also, I'll just throw in there that I think a lot of students have the tendency to want to delay the exam because right toward the end, they think they, one more week is going to give them, a boost. And I just, usually when you're ready, you're ready. So make sure you have a good mentor that's talking to you so that you can resist that urge of like delaying that test. I just want to throw that out there. So it's just
honestly, if you walk away with one piece of advice, I say that's the best one. Colleges usually, like we set a date at our school and we do that on purpose because there's diminishing return after a window of time. And we all second guess ourselves. And I will reflect back on, students said that it's easier now that you have it pass fail. I would say the best part about my experience was I didn't get to pick the day and I had to show up with a pencil and take the test. It takes a different level of stress. You have no control over the environment, then you just do it. And I think that actually having the flexibility of an exam date causes anxiety that's not necessary it's not helpful. Yeah, I would say.
We're just a bunch of Gen Xers who had writer's cramp when we did the test. So.
Well, it was too late. And I will say, I asked a student before this today. I saw a fourth year student matched into EM, high performing student. I said, do you think that pass fail will have a positive effect on students' anxiety about preparation for the exam? And he gave me the exact answer I expected. He said, that's a really individual question. And I said, yeah, I want your answer. I know you, tell me what you think. And he said, so for some students it might, but and then for some students, they're not anxious. They just need to put the work in and do the job and they're going to do it anyway. And he's like, I would have studied no less or no more, knowing the exam was pass fail, and he performed well on it, but it wouldn't have changed the way I approached it. I think that students who are concerned about passing are still going to be concerned. High performers who still just do it because that's what they do will still do it. The anxiety piece is not, I don't think it's going to be changed. I don't think this class has it better. I had kind of hoped that, but what I've seen so far is we all want to do well and know what we know. So it's a new thing. I think this is going to be good for the profession of for all of our professions as we move forward in the long run. It's just working out the kinks. And I think approaching the test, my goal is to pass this exam, is a way to think about it and not worry about the other pieces of it until they fall into place. Residency match doesn't matter today. Passing the exam does, where I think in the past, the score meant more. So I think there was unnecessary anxiety around that, but I just think we just shift where the anxiety sits, to be honest with you.
I do want to answer this one question about one of the students, an anonymous attendee, who said, their school's residency advising department in flux. As a dean, I understand that, and that's happened, when people change and everything else. What I recommend, actually, instead of giving you an answer of resources, your resources are at your college. And so what I recommend actually is to go to, if it's whichever is the appropriate dean or chair or whoever it is at your school, with specific requests and questions and concerns that you have, and say, which person who's here right now should I engage them directly in a productive conversation. And I can say, at least from my perspective, that even when we've had a change in personnel in a department that has morphed or something, the people who are around or generally who need to help you are there. And go with a very specific request, and that would be my first recommendation. You'll get hopefully you get a very specific answer and some help.
But I'll add on to that. Especially go to the actual specialties as well. The website that talks about how to apply for that specialty, make sure you're doing your research on it as well so that you can ask those poignant questions that Dr. Kirsten said, and get to that right person to help with advising.
I think this has just been, I know we're at time here, such a wonderful and insightful session. So thank you, Drs. Kirsten, Jerome, and Allgood. We really appreciate all of your time and commitment to support the medical student community. Seriously, thank you. I think we've all walked away with so many nuggets and pearls that we can utilize for the exam. And also thank you to everyone for taking the time to attend tonight. We all know that you're super busy, and we hope you found the content helpful. And lastly, just good luck on your exams, and feel free to reach out to our teams if we can ever be of any assistance. Know that we're here to help in any way that we can. So thank you all, and good night. Thank you, Dr. Allgood. Really appreciate it. I didn't get a chance to say thank you again to Dr. Kirstein and Jerome before they hopped off, but you were fantastic, and just thank you so much.
Thank you. I was waiting for the recording to go off, but even if you send this out, I'm blessed for the opportunity to be here. So thank you. So I'll see you next time. If you need anything, please let me know.
Absolutely. Appreciate it, and have a good evening.
You too.
Bye.